Welcome everyone to IsisParenting's Sleep Support Webinar and Chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board-certified lactation consultant, and board-certified in pediatrics. I'm the mom of 2 older teens, and I'm here outside of Boston, Massachusetts, at IsisParenting's home office, where I oversee online learning and the clinical content at ISIS. And with me today is my friend and colleague, Megan Casano. Meg is the mom of 4 beautiful daughters and is the IsisParenting sleep team leader. And today is going to do a quick revisit on last week's topic, just to quickly review what interval and check-in approaches are and mean, and then we will deal with all of the frequently asked questions and concerns about a method like this. And it's not a method that every family is comfortable with or will embrace. But on the other hand, it can be an effective and carefully and thoughtfully done method that can take 3 weeks or months of angst and anxiety into 3 evenings worth of focused attention and leading to better sleep. So there's a lot of different schools of thought. There's also a lot of misunderstandings as to what this is and isn't. People refer to it sometimes as the cry it out method, and we never like that term because that means many different things to many different people. And I think sometimes people think the cry it out method means you put a child in the crib or in the room, close the door, and don't go back. And that may not be an appropriate way to help a child learn new sleep associations. That may be a way to heighten anxieties all around. So we'll talk a little bit about what it is and isn't, and how you may carefully and thoughtfully consider an approach like this if and only if it's something that you think is going to be right for your family. Meg, how are you?
Thanks, Nancy. I'm good. Thanks, everyone, for joining. So we do have the recording from last week where we really went step by step through an interval or check-in style approach. And we really talked you through exactly how to do this method. So this week we are going to do something a little bit different. You can go back, you can listen to the, how to. And so for this week, we wanted to make sure we had a lot of time to get to your questions. I like Nancy's intro. I think it's important to stress again that, when you come to ISIS for an individual sleep consult, you do not get a one-size-fits-all. A lot of books you buy out there are great and written by really educated, thoughtful people. And they tend to offer sort of one style, which is fine, but every family is different and every family has different circumstances. We don't judge, we don't, we really embrace each family. Some families have hectic work schedules, multiple children, illnesses to deal with, illness of a spouse or a parent, extreme exhaustion, they're really suffering, postpartum depression. And so for some families, a faster technique is really the best fit for everyone. And so yes, the intervals, check-ins, called a lot of different things by a lot of different people, Dr. Ferber, of course, being the most famous. But this type of technique can be modified. It can be tweaked and changed a little bit so that it can really fit a family's needs. We can alter it to allow for more soothing, more frequent check-ins, so that some families really feel like this is actually really great, a great fit for them because it is pretty quick. And so, the other big things that I really tried to stress last week was that this plan really is only appropriately done under the right circumstances. So you have to be starting at your baby's appropriate bedtime. If you've had a late afternoon cat nap that sabotaged your baby's sleep pressure, that's his sleepiness, and it's going to be difficult for him to fall asleep that night at bedtime, that might not be the most appropriate night for you to start. So you're going to want to make sure you've got your baby's schedule really ironed out. as you're going through your soothing responses, your check-ins, it's important to be nice and consistent in the type of soothing that you're offering. And again, the step-by-step is all on the last week's recording, which Nancy's going to post for you, so you can go back and listen exactly how to do this. But some of the questions that we're going to go through today were about hunger and feedings, and so we're going to talk a little bit more about that. Remember that as you're doing check-ins with your baby, if you ever got to a max out point, let's say you got up to a 4-minute check and you felt like, this is it, I don't think I can stay out of the room longer than 4 minutes, then you can stop there on that night, and you can just keep visiting at 4 minutes, 4 minutes, 4 minutes. But the next night you would want to sort of bump it up a little bit. Maybe the next night you could stop at, say, 6 minutes, and so that you don't get stuck in a rut. I mean, that's the big thing with any intervention. If you do the same exact thing every single night, you're going to get stuck continuing to do the same exact thing every night. And I think we have a question about that too with the Trading Down Sleep Associations. And I also wanted to just mention, because I don't know, I find this a really helpful way to think about things, is that when you start an intervention with your baby to try to improve sleep or teach him how to fall asleep on his own at bedtime, remember you almost always start at bedtime depending on your circumstance. When you ask your baby to make a change, he will typically resist his sleep pressure as long as he can. And for most babies, that's a good 40 to 60 minutes. Okay, so when you make a change, whether you're using a soothier technique like a Trading Down Sleep Associations, whether you're using a little faster technique like a check-in style, or whether you're using something in between, it's still probably going to take your baby about 40 to 60 minutes to fall asleep under new circumstances. Okay, so just because you're doing a soothier method doesn't mean it's going to go more quickly. In fact, the difference really is, what will your response be during those first approximately 40 to 60 minutes on that first night, but also, on each subsequent night, what will your response be? And then depending on the type of plan you choose, that is what will affect how many nights in a row you're going to work on things. So time it takes your baby to fall asleep is unknown. Number of nights you spend working on a change, that we can more kind of put our finger on, and that is based on the type of plan you choose. Hopefully that, I like thinking about it that way. I think it's helpful. Okay, so I want to be sure, we have a lot of great questions. I want to be sure we have plenty of time to go through them. So Nancy, were you going to read? Did you want me to start reading? Did you want to read them so the group can hear?
No, I can read the first one, and there's like all of a sudden some kind of crazy banging going on in the background here. So here you have it. Okay, here's a mom who says, let's see. Can you hear that banging?
A little bit, but it's fine.
Okay. A mom says she's in the middle, and you can maybe explain what some of this means. We're in the middle of an extinction burst. 10 days of awesome overnight sleep, with the last 2 nights consisting of 90 minutes of crying. What should we do? Start over from the beginning? The baby is 6.5 months old.
Okay. I don't see this mom's name on the list. Of course, whenever I'm doing troubleshooting, I have about 50 questions that I want to be asking to figure out why exactly it's happening. An extinction burst is basically, it's what feels like a regression after you've had perceived success. So you may have several awesome nights of sleep and you think, this is great, we're done. And then all of a sudden you have this it's almost like testing, like, your baby's way of saying, are you guys really serious about all this? And typically you use your check-ins to assess your baby, make sure nothing's come up, he's not come down with something, 10 days were great, now he's getting sick, or he's got a big tooth that's just coming through the gum line on those sensitive nerve endings where it's sore. There hasn't been a change of any type. So you can use your check-ins to evaluate your baby and make sure he's fine. And if you're feeling really confident that he is, you would continue with your plan. At whatever point you had left off is fine. If you want to start back at more frequent check-ins, that would be fine too. But basically, if you had 10 days of awesomeness and then a couple nights that you felt like you totally lost your footing, but you're sure your baby is fine, then you just you do it again. It's like a little bit of reminder work at that point. But sometimes it's helpful to try to figure out why. Again, you're looking for anything that could be a culprit. Did baby just learn a new milestone, developmental milestone, just learn how to crawl? This baby's 6.5 months old. Is he just about to get a tooth? Did you have a lot of travel? Did you have a couple of days where the naps were really scattered, or some overtiredness as you're going into your day? Or did he have a late nap and that there was something off with the timing of the schedule? If ever you have something that seems abnormal for your baby, you want to really look carefully at all components of sleep, from the more biological stuff like schedule, sleep environment, hunger and feedings, and things like that, and from sort of the psychological, like the attachments to ways your baby falls asleep, bedtime routine, consistency. So you really do need to look at the whole picture when it comes to solving a problem.
Excellent.
Okay.
The next question is from one of our regular viewers, listeners, and her baby is 9 months old, and she has a question about using intervals during nap time. She says she's been working on helping her 9-month-old to go to sleep for naps on his own, like he usually does for bedtime. And she's working hard with all of her ISIS knowledge, she says, in terms of timing, environment, but sometimes she puts him down and she knows he's sleepy, but it still takes forever for him to fall asleep by himself. And he's not upset or crying, just crawling, standing, plopping down, playing with his lovey or binky. This can go on for a long time, and Mom knows if she went in there and rocked him, he would go right to sleep. So she starts watching the clock and worrying about how short his nap will be in order to keep the timing on track for bedtime. So should she not worry about that and trust that he'll learn to fall asleep more quickly, or should she help him keep to a tighter nap schedule and help him fall asleep? What do you recommend?
Well, that's interesting. This is Christine. Christine, can you type in what time is Brooks waking up and what time is the nap in question, or what time are the naps in question? Now that he is 9 months, he can withstand longer sleep pressure than he could at, say, 6 months. I'm assuming I can't remember from when we spoke if he's now on 2 naps a day. Afternoon nap, 3. Okay, so Christine, is it the afternoon nap that's the trickiest one? The morning nap is going fine? Yep. Okay. This happens sometimes. So yes, okay, great AM nap. He's 9 months old. He can withstand more sleep pressure. Make sure you've got lots of play and activity between the 2 naps. If it's helpful to stretch those naps out a little bit more, like 3.5 hours of wakefulness between the naps to increase his sleep pressure, that's fine too. I know you do nice soothe down, wind down soothing routines. So do make sure, like if he needs a little bit extra soothing into a sleepier state when going into the crib, that's fine. It's interesting because, he's not upset. He's in there hanging out. And like Nancy says, which I love, it's a division of labor that you can't make him sleep. But, you can use a check-in to, even though he's not crying, you can use the check-in to go in and out of the room and offer him some soothing, if that's helpful. I mean, if it riles him up, you might choose to stay out. But if it's helpful to go in and give him a little back rub or sort of a heavy hand on his bum, a little soothe of the cheek, you can do that too. You said sometimes it's 4 hours. It can be that long. Yeah, he's in that age. He's too young to transition to just a single nap, but he may be ready to fall into sort of a little bit shorter night's sleep, like really 10.5 to 12 hours would be average on the overnight, and about 3 hours during the day. So, if you sort of look on paper, if he seems well rested and he seems happy, and he with your nap spacing that you have going on, if that only gives him a 10.5 to 11 hour night. Okay, you're answering my questions as I'm saying them. This is great. I think he's doing fine. I know that it's stressful, but he's in there. He's not crying. He's trying. We can't force him to sleep. We can to provide him the time and opportunity to do it. Yes, that his schedule is important. So if you increase the space between the naps just a bit for a few days, and if that causes him to fall asleep more quickly, and then you can try to decrease the spacing between the naps again, try to back him up. For example, maybe you stretch the window of wakefulness to 4 hours for a couple of days, see if he'll go down 1, 2, 3, and then you can try to back it up to about 3 hours between the nap. Make sure he's still having his great overnight sleep. And if the check-ins are helpful, yes, you can use them.
Great.
Hopefully
the reason I changed the slides were because we have 3 questions that have to do with sleep regression. And one dad is here who has 2 related questions. 7-month-old baby girl used to sleep better, but now is waking up 3 or 4 times a night. And a related question is they want to transition out of the Merlin suit. And then another related question is a mom who says she has a 4-month-old who was sleeping 9 or 10 hours at night consistently until about 3 weeks ago. Now she's up 3 or 4 times a night, can sometimes go back to sleep with another soothing approach, but usually requires nursing back to sleep. And mom is getting exhausted, and they're wondering if 4 months old is too young to use an interval approach. Mom doesn't really want to let her cry, but feels like what's going on isn't sustainable. So I thought maybe to do a quick romp through sleep regressions and how to assess the sleep regression scenario, because I also got 2 questions on Twitter today about 5-6-month-olds who are no longer sleeping well at night. So I can refer them to this Q&A session.
Okay. And the 7-month-old it was the same kind of thing, was sleeping great in the Merlin and now all of a sudden waking up?
It just all I have is 7 months old, used to sleep better, now wakes up 3 or 4 times at night. Yep. Okay.
Yep. So that's why we say the 4, 5, 6, 7, whatever month regression. Typically it is closer to 4 or 5 months. A lot of times what you did for a long time with your baby, rocking to sleep, swaddling to sleep, nursing to sleep, you had like these great 9-10 hour sleep stretches and you thought you had the golden ticket. And then, sleep regression, a significant, often sudden change in sleep habits for the worse. It does often coincide with increased level of awareness, particularly if you have a sleep association like nursing, rocking, holding, and your baby now realizes, I want that every time I wake up in the night, which remember will be between every sleep cycle. So your baby could potentially be waking as often as every 60 to 90 minutes, particularly in the second half of the night when sleep pressure is lower, looking for that sleep association. So if you're sort of like, aha, I've been rocking my 7-month-old to sleep, that might be what it is, or been feeding my 7-month-old to sleep, or feeding my 4-month-old to sleep, it could be the result of a sleep association. And so you have some regression. So in any case, 4 months is about the earliest that I would suggest using an interval technique, and that would be 4 months from due date. It does typically work best 4.5 months and older. And but if you're really feeling exhausted and you're really in a place that's just not sustainable, yes, you can start it at bedtime. Go back and check out the webinar that we recorded last week for step-by-step how-to and also expectations. You would not try to do this through a time that your baby's been habitually feeding. You don't just cut off feedings cold turkey, you reduce them slowly. You also, for a 4-month-old, your expectation would really just be for first third, maybe first half of the night sleep consolidation. And so you could apply this method to bedtime. You might apply it to a 9 or 10 or 11 o'clock wake up, but you probably wouldn't have the kind of success you're looking for at 3 or 4 in the morning when sleep pressure is lower. 7 months, that's different. 7 months, you have full night consistency expectation, and so you could apply this for the full night. Again, though, you're not trying to plow through feedings cold turkey. You're weaning down feedings that need to go, keeping feedings that need to stay. So take a look back at the webinars recorded on feedings, what time your baby would typically be eating, how to reduce a feeding gently overnight. And look at last week's webinar to learn about expectations by age, when you can apply this technique. 4 months is the earliest at bedtime, 5.5 to 6 months for a nap, and 6 months for full night. The question about the Merlin and the best way to transition out of it, as Erin, who co-leads the sleep team with me, likes to say, when you change something, like you stop swaddle or you stop the Merlin, it's going to rock her world, and it will probably take at least 3 nights for her to get used to it. And so when you make a big change like this, it's helpful if you're prepared with a backup plan for what if things aren't going well. How do I want to respond? You could use a response like the interval check-ins. You could use a soothier style response like trading down sleep associations. The best time to stop the Merlin for the first time would be bedtime, when her sleep pressure is the highest and her sleep hormones are going to build and cause her to fall asleep the most quickly. Better to do it at bedtime first rather than, at 4 in the morning or for a nap. What else? Oh, and then just to note, the mom who said, I think with the 4-month-old, so she doesn't want her baby to cry. Did she say that? Or she didn't want a method that involved a lot of crying? Is that what I remember hearing you say, Nancy?
And I don't know, I don't know if she's new to the sleep webinars, and that that this isn't a primary approach that we talk about. There's a variety of different types of slower and soothier approaches.
Right. Yeah. And so if your priority is actually, I'll put the time in, I don't care, my priority is to make this as soothing a transition for my baby as possible, this interval technique is probably not your first go around, probably not what you go to first. You probably would want something more like trading down sleep associations, which we have a webinar recorded for. That would be a more soothing approach. It would take you longer, more time investment, more consistency for a longer period of time, but it would be more soothing. So you just, you sort of think about what's the priority. And then, of course, if you need to be walked through step by step on the phone, then a sleep consult is always great for that too. Okay, did I cover all of the, did I cover everything in there, Nancy? Okay.
I think so. Maybe just, since I have this slide deck up, maybe just, go through briefly again. What do you do when there is a sleep regression, just in general? You started out along that route. What does a sleep regression mean? Developmental changes, teething, traveling. Sometimes I don't know if this comes up, I can't remember the slide deck. Yeah, sometimes I think a lot of sleep regressions sometimes are the beginning of the clue that maybe it's time for a nap transition. Would you speak a little bit to that, Meg, that maybe it is time to go from, in certain situations, you're seeing more nighttime waking up, maybe a child is ready to go from 3 naps to 2 naps, or maybe because they've moved to 2 naps, their bedtime is earlier, meaning now they're up quite a bit at 2 and 3 and 4 a.m. because they're just not as tired since they've got an earlier bedtime.
Right. Yeah. Sometimes, it's very easy to hang on to, well, what worked for the last 2 months, as your baby grows and their schedule transitions around, so much changes sleep-wise and schedule-wise, between 4 and 6 months, and then again between 6 and 9 months, particularly between 4 and 6 months. The schedule is really in flux and emerging. And so sometimes parents kind of get stuck in a newborn rut and napping baby too frequently, or, kind of what I was saying to Christina about Brooks, that as your baby gets older, they can and should withstand a bit longer longer stretches of wakefulness, greater amounts of sleep pressure. I'm not talking about, sleep depriving your baby or anything like that, but, it's just important to make sure your schedule matures with your baby, and that you're not putting your baby down too early or expecting too long in the crib. Depending on what you've been reading or hearing, some parents really think that 12 hours of sleep and 4 hours of nap, and that's it. And really, that's above average for babies who are over 4 months. That's really a bit above average. So you're checking your expectations and making sure your schedule is growing with your baby. And then, if you have had a sleep regression and you've sort of ruled out anything,
One
there's
frequently asked question about.
Yeah. Go ahead, Nancy.
Go ahead.
Oh, I was just gonna say, if there's been a sleep regression.
I was just gonna.
If there's been a sleep regression and you realize that it is tied to a parent-led sleep association, like rocking, holding, feeding, nursing, bouncing, whatever, your baby to sleep, and now your baby wants that every 60 to 90 minutes, it's a good time to start on an intervention to change that sleep association to a baby-led sleep association, so that your baby can then, put herself back to sleep in the night and those times when it's not time to eat.
Right. And I think that ties in with a frequently asked question, and somebody, in fact, just asked it. When you're trying to do an intervals approach, how do you know, or most parents are worried that the baby may actually be hungry, that they're trying to get the baby to sleep during a nighttime waking when, in fact, the baby is hungry? Would you say that the sort of every 60 to 90 minute waking might be a clue for that?
Well, right. For I'm assuming we're talking about babies who are now older than 4.5 months, and particularly older than 6 months if this is a full night intervention. But when we do a sleep consult, we really map out the night. And so it's important, if you're going to start this, that you sort of look at your whole night ahead of you first, and you ask yourself, what do I think my baby needs overnight? You can look back at some of our webinar recordings to find out, sort of what's typical age by stage. You can double check with your pediatrician's office, the nurse on call, and just say, how many hours can my baby fast now? Like, what should he be doing? And they can help guide you to that if that gives you more confidence. Generally speaking, between 4 and 6 months for healthy babies who are following their growth curves and gaining weight, 2 feedings in the night is not considered a sleep problem. I'm not saying your baby needs 2 feedings in the night, but it's not a sleep problem if sleep is consolidated on either side of those feedings. Many babies in that age range only need 1 feeding, and some would do none. Between 6 and 9 months, having 1 feeding is not a sleep problem. Some babies would still be having 2 feedings, and many babies at that point would be able to go through the night without any at all. So, Nancy and I tend to be more conservative with feeding recommendations, particularly for breastfeeding moms and who are trying to keep supply up, working, pumping, and all that. In the first year, we don't go cuckoo about night feedings. If sleep is well consolidated on either side and the family's happy with the situation, we're fine with it too. So you kind of have to ask yourself, what do I think my baby can do? If, for the question, if you've made the decision, okay, my baby is, say, 8 months old, he really only needs to eat once in the night. It does typically work best if that feeding is in the last third of the night. Not always, but typical. And so if that's the case, you would want to wean down any extra feeding. So if your baby's been eating at 11 or 1 or both, he really thinks he needs to eat at that time. His body really gears up for digestion, his tummy rumbles, and he really does feel hungry. And so you would need to spend some time weaning down those feedings, trying to reverse that habitual digestion cue. Okay, so that solves all right, I know this isn't about calories because I'm reducing the milk and we're transferring feedings into the day and I'm confident with his needs, but it doesn't solve the, more psychological attachment to help, I want a nurse, I want a snuggle. And for that, you address your sleep association with whatever technique you're doing. If it's intervals, you do intervals. If it's trading down, you do trading down. If it's something else, you do something else. Remember that you're starting at bedtime first, so it wouldn't be fair to nurse your baby to sleep at bedtime and then at 1 a.m. say, sorry, you're on your own. So you really have to make sure expectations are consistent, weaning down extra feedings, feeling confident that you and your pediatrician have made the decision that what your baby needs overnight, and then you go for it. Then you do it. And remember, change is hard. Might take your baby quite a while to fall back asleep and under new conditions, and so you don't put a time limit on that because you don't know how long it will take. You focus on being consistent. That was a long answer.
Great. Okay. I think the final 2 questions are somewhat related, or I can make them a little bit related, and then we'll wrap up. Can you talk a little bit about sleep and nap pattern expectations by age and stage, even though I know this is a huge topic and we have extensive webinars. We've broken up sleeping and nap patterns by age and stage for a variety of age groups. But I have one mom who wants to know, is 6 months old too young for 2 naps? And another mom in the chat room, you can see Irish Ellen outlined her 14-week-old's sleep routine. He's getting about, what is that, 9 hours, about 9 to 10 hours at night and 2 to 3 naps during the day, which are sometimes short. And she wants to know, is that all right? So what do you think about 2 naps for a 6-month-old and that type of nighttime sleep? I guess I'm looking at, well, from 10 p.m. to 8 a.m., that's a late bedtime, but the baby's sleeping in nicely in the morning. We see a heck of a lot of complaints from parents whose babies are getting up at 5 a.m. On the other hand, a lot of those babies are probably going to sleep at 7 p.m. So pick your poison, ladies and gentlemen.
Right. Yeah, I mean, the short answer for the 6-month-old is yes. Between 6 and 9 months is when 3 naps typically consolidate into 2. So 6 months is generally about the earliest. I would say at 6 months, you'd have to have a really solid night that would support the transition, and you'd have to have 2 great naps. 2 40-minute naps with ultra-long stretches of wakefulness between them will probably not be sustainable for a long period of time. But if your baby's having about 3 hours of daytime sleep between those 2 naps and a nice night, yep, it's fine. Your last stretch of wakefulness, you typically want to be your longest of the day. For Ellen, 14 weeks, you're still under the 4-month mark. You're still in newborn land. There's no solid daytime pattern yet. You should have a regular bedtime. It looks like you do. I remember, Ellen, that we talked before about how you could move the bedtime earlier if you wanted to by darkness exposure and backing up the bedtime routine. But I know over there in Ireland it's light a lot longer, and maybe that time works great for your family. So on paper, 10 hours sleep for a 14-week-old is average. Daytime sleep, though, you're still probably in the above 3 hours a day range. So you just want to make sure with the night that's a tad on the shorter side, that the total daytime sleep is really solid. I mean, yes, having nap lengths vary from 40 minutes to a couple of hours. That is still normal. You're really looking at the total sleep that he's getting during the day. Okay, hopefully, was that good, Nancy?
Yes, absolutely. And I know that at 14 weeks, that's really just sort of the very beginning time of when we talk about struggling. It's a hard time for naps because the baby is no longer a newborn, which means he's just tired and going to conk out as soon as you put him in the sling or carrier or the stroller or the car. He's just zonked out. That's what a newborn typically does, and a 5 or 6 month old may be ready to begin working on napping in the crib. And so kind of in that in-between stage, it can be challenging. Those babies still are somewhat dependent on needing help to fall asleep and stay asleep, but you're trying to move away from always having to facilitate that nap. And there's a lot of pop-up naps. These 40-minute short naps that Ellen is describing are what we call pop-up naps. And sometimes if you can get to the baby quickly and try to resettle him back to sleep, you may be able to achieve another sleep cycle. And so that 40-minute nap hopefully turns into a 90-minute nap. And as the baby gets a little bit older and more matured, hopefully he will be able to put himself back into that second sleep cycle. So I can, on Twitter or after I sign off here, I'll put some links up. We have a couple of webinars that talk about helping the baby learn to nap and managing those pop-up or ultra short naps. So we can give you those links. Meg, what are we up to next week?
I was just thinking about that. We have quite a library. I feel like we might pull apart one of our past recordings, like twins or siblings. You guys, you are here in the chat room. What do you guys want us to talk about? What do you want to hear about?
We certainly always do have lots of moms of twins. Maybe maybe we could do something. You certainly do a lot of twin consults.
I do.
Maybe you can sort of do what are the FAQs for parents of twins. That might be interesting. All different age groups.
Yeah,
since we have a webinar on room sharing that discusses twins, but
right.
Yeah, that might be interesting.
Yeah, because we did twins and siblings. Yeah, we'll think about it.
All right. Everybody have a wonderful week. Safe, healthy, happy sleep and nurturing. Love your babies. And let's see, on Thursday I have the breastfeeding webinar, and I am redoing the nipple shields episode, the thrilling adventures of nipple shields, because I realized the sound quality on that one was very, very poor. So I'm going to redo that one. And if you have nipple shield stories, please come and share them or tell your friends. And I'll also do Q&A, of course. And we'll see you back here next week for the sleep webinars. Please help us by spreading the word to any email lists, moms groups, parenting groups, Facebook. We need all the help we can get to get the ISIS information out there. And thank you all. And thank you, Meg, for sharing your expertise with us.
Thanks, Nancy. Thanks, everyone.